So this, as I was telling from the beginning, pulmonary rehabilitation is the most important topic which can do wonders to many of the patients. Basically, what is a pulmonary rehab? It is a supervised education and training program designed to help people with chronic, which is long-term lung diseases. So, as we have seen, rehabilitation in case of say musculoskeletal injuries, when somebody has a knee pain and undergoes a knee surgery or something, post that he would be on rehab for a longer time. So the same is uh, very well followed up in neurology. A patient who has was had either an ischemic or hemorrhagic stroke with hemiparesis, how much important would a rehab on him? We all know the same amount of emphasis has to be laid on pulmonary rehab, though the reach of this is quite less still in our country. We have to definitely, this has an important role to play, and this more emphasis has to be put on, and the onus is on our sides as doctors to ensure that this can be taken up appropriately, because this is a treatment where most of the patients would like it. It would be tailor made for them, and as there is no drug involved in rehabilitation, they would be very happy about it. um, so it's a win-win situation, and we need to just ensure that the right benefit can be reaped from this for the patient. The basic goals of any pulmonary rehabilitation program would be: first is to improve their symptoms, restore their functional capacities to an extent possible, and third is overall quality of the life should be improved. See, any patients with chronic lung disease also suffer from anxiety and depression and can contribute to the uh, mortality and morbidity of the disease in a very significant manner. So addressing this is also a part of rehab. So when a patient does some kind of an exercise, the exercises of course have to be tailor made, initially monitored. There is something called as target heart rate. There's something called as the effort tolerance. There's something called as VO2 max. All those have to be appropriately assessed, and accordingly, the prescription of an exercise has to be given by a field expert in pulmonary rehabilitation. Most of them would be physiotherapists in alliance with uh, properly trained uh, pulmonologist who is well aware of this program. So, with respect to anxiety and depression, as I was telling about how important it is also to tame the mind and give them that positivity mentally, is also an important part of this program. Psychological interventions for these patients include disability evaluation, vocational counseling, and continued education, both to the family and patient. So it is, I mean, you can probably, it's a modified form of cognitive behavioral therapy customized to these patients. Next slide, please. So now that we have understood most of the things, I would just quickly wind up on this, and would be more interested in discussing and taking up questions regarding the same. Many lung diseases have a natural history of prolonged illness. We all know that apt diagnosis and detailed evaluation is the key to good prognosis. And as the patients have to survive with these conditions for a longer time, of course, a detailed evaluation and right interventions are uh, very, very important and play a key role in further life of the patient. As the treatment modalities are non-conventional, educating patient and family is very vital in with respect to pulmonology. Pulmonary rehab forms a major non-pharmacological treatment measures for managing many chronic lung disease patients. So with this, we'll just conclude this and